for them. It's
Gotcha.
free of charge. There's no problem for that.
Now, one thing I can see happening is we have a person who, a very well-meaning individual that says, oh, this isn't expired, and guess what? My cousin has an upper respiratory infection. It looks like they have an issue right now, and I got this antibiotic that I didn't finish. Why don't you take some of this stuff? It helped me. And very well-meaning. They're recycling the medication, they think, right? And also helping their family member, but is there an issue with that?
Never use someone else's medication. Everyone is different. It has a different chemistry in their body.
Yes.
So never use it.
All right. So, okay. You had something?
One more thing. I just want to, watch out for the children as well. When you're throwing out medication in your plain regular garbage, just make sure it's, sealed, put in a bag, just because there's pets that can go into that garbage. There are little children that can pick it up from that garbage and take it in. And human medications are actually the leading cause of pet poisonings.
Yeah.
So we just want to watch out for our dogs and cats
We
as well.
definitely don't
Yes,
want.
yeah, very
We don't want to poison our cats and
Yes,
dogs.
yes.
No, you don't want to do that.
That is not cool. All right, ladies and gentlemen, you're listening to Health in Harlem on WHCR 90.3 FM New York. We're going to take our last break for the evening. You can call us, though, at 212-650-6903 if you have any questions, comments, or concerns. And you can even hit us up on our Facebook page and ask us a question there. You can leave comments or even just like the page. I will settle for that. All right. We'll be right back after this break. Stay with us.
WHCR 90.3 FM, New York.
En el 2014 de Adam Clayton Power Jr. Boulevard, entre la 120 y 121 está Inking Time. Impresión y bordados de camisetas, sudaderas, jaques, gorras, uniformes deportivos, artículos promocionales en general y todo tipo de promoción impresa. Para mayor información, 212-234-2844. Inking Time.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
WHCR 90.3 FM, New York.
Welcome back to Health in Harlem, ladies and gentlemen. I'm Maurice Selby.
And this is Sean Shivers.
And tonight we have with us the doctors. Dr. Shahnawaz Khan, he's the director of pharmacy at Harlem Hospital and the Renaissance Healthcare Network. And we also have Dr. Maheen Khan.
Junior Khan.
And Junior Khan, a.k.a. Junior Khan tonight. Right? And ladies and gentlemen, we're talking about National Pharmacy Week and the importance of being aware of medication safety, how to take medications properly, and dispelling some myths and misconceptions that are out there regarding everything from vaccines to prescription drugs. Now, before we get back to our conversation, we just have some very important announcements to make. And one, we have this weekend. Oh, you want to make that one? This is the most immediate.
Yes.
one.
This is Making Strides Against Breast Cancer Walk is coming soon. Join Harlem Renaissance Walks. Be a contributor, walk, donate, raise funds, walk with them, strives towards the world with more birthdays. And this is just a breast cancer walk.
Yes.
It's going to be in Central Park at 76th Street, Bandshell at 9 a.m. Again, the date is going to be Sunday, October 21st. And the contact person, I don't have an email. I don't have a a sight. But I'm just going to give you her number. My girl, Kalata Klein, in the Patient Safety Department of Harlem Hospital. And her number is 212-939-1278. So if you want to walk, donate, help raise funds, show your face at this walk, just give Kalata a call. And her number again is 212-939-1278.
I will add one more thing about this breast cancer.
Yes, please do.
The Harlem Hospital doing a free screening for this.
I love that word. Yes. Free
screening.
Keyword.
So
free.
It's very important thing. All are invited, especially the women after 40 years of age, they should come and they have to yearly basis. After 3 years, they have to be.
Or if they have a family member that's affected, absolutely. It's Breast Cancer Awareness Month.
Yes.
So let's show our support.
On top of Pharmacy Month, this is
a lot of things going on.
A lot of things going on in October, and I want to just point out that the forecast says sunny that day.
You better have the
slight chance of rain with some wind.
On the computer screen.
Slight a chance of rain with a little bit of wind at 9 miles per hour. That's not much, so it's a nice little breeze.
It's gonna be nice.
Little breeze, and it's sunny.
67
yes.
is gonna be nice.
So please, if you can, make it out there that day. Check it out, and also you can get your free healthcare screenings by Harlem Hospital. And it's a lot of fun going to those walks. You can meet people. All you single individuals out there, you looking for that match? Don't go to Matchmaker. Don't go to all these other places. Go to the breast cancer walk on Sunday, and you might find the one. Now, I have another thing that you want to be on the lookout for. Save the date. The 2012 annual public meeting of the Community Advisory Board for the Renaissance Healthcare Network. This will be held next week, ladies and gentlemen, October 25th, starting at 6 p.m. The theme is healthcare a luxury or a necessity? We don't have to answer that question on this show. We know the answer to that question for sure. Now this will take place.
I'm going to that.
That's what I'm talking
about.
Wait. Oh, for an hour?
Well, yeah, I'm going to
go 40 minutes.
I'm going to go for 45 minutes, and then I'm going to come here and I'm going to speak on what went down.
That sounds like a plan. Now, this will take place once again next week, October 25th, starting at 6 p.m. Thursday, October 26th, October 25th. And it'll take place at the Adam Clayton Powell Jr. State Office Building, the big building on 125th Street. That's 163 West 125th Street, in the second floor art gallery, and refreshments will be served. Now,
and Maurice, I want to bring an issue with our youngster, and I want to invite them to know about the pharmacy profession. And now we are dealing with the Toro College in our neighborhood, and if I can convey the message that they can come to the Harlem Hospital, they can visit to the pharmacy, we can discuss with them, they can do it as a volunteer to know about the pharmacy profession. If they like it, we can train them as a pharmacy technician. And if they like it, they can go to the pharmacy school. And in this way, they will be very helpful for their community and their family.
Thank you very much.
That's how you get back to the community.
Yes.
That's how you do it.
And shout out to our Toro students this month as well.
Give that shout out.
That's what's up. There we go. And we got to show love. And actually, I want to shout out my aunt, Barbara Stevens. She is actually works for Dr. Khan at the hospital, in the pharmacy, at the Renaissance Healthcare Network. So shout out to my auntie. I love you so much. And
any more shout outs we have out there?
All right. And you know what? The last thing we just want to wrap up. Now, what are some of the most important things that people should take away from tonight's show? If they learned anything in terms of what we've talked about with safety and medications, what is the most important thing that people need to take home?
Okay. Let me go first. The patient safety is very important thing in perspective with the medication. You must discuss with your physician, with your pharmacist about the medication. Always read and check your medication, and do not leave any open space where children can reach those medications. Never use someone else's medication. Bring it your brown bag to the pharmacy next week. We will help you to separate unused medication. We will take back from there. So that's the advice from me to all our community.
All right, thank you.
And to get your flu shot.
And get that flu shot.
And one last thing I want to throw out there real quick. before the show ends, because we talked about it a little bit during break, Dr. Khan, is that with Obamacare, prescription drug benefits have changed. Can you tell the community real quick what changes took place a little bit?
It's taking place. Is not done yet, but it is in the process, on the way. And what's gonna happen? Everybody will get the same treatment, same health care, and they will be included in all the medication which some person has it and some insurance has it.
Yes.
Some person does not have it. So it will be under one insurance. Everything will be taking care for all the patients.
All right.
And you know, so, no offense, but at the end of the day, you know, if I get sick and I have health care coverage, I'm going to get well. If someone else gets sick and they might not have the same, or they might pay a little bit less, or pay a little, who cares as long as at the end of the day, everybody is treated.
Everybody's
That's
taken
just
care
how I
of.
feel.
Yeah,
That's
right.
just my opinion.
Yeah. No. So this is very important thing. It's
Yes.
very important. And especially with donut hole with our seniors, it will be abolished.
Yes.
There will be no more donut hole in the Obamacare.
Okay. And can you talk more about the donut hole
Okay.
briefly?
Okay. What happened up to certain limit, the government wants to, now insurance company want to pay by the patient, like 700, some 1,000, some 2,000. So they have to pay to cover up the donut hole. Therefore, they call hole
Yes.
to cover with the money.
That's right.
So in the Obamacare, it will be abolished, and you do not need. Everybody will be treated with whatever the amount they're gonna charge. They're gonna charge from me, from you, from our
Yes.
seniors.
That's what I was
So it
saying.
will be a good plan for our seniors.
So
Yes.
the donut hole is not actually food. It's
Okay,
actually
yeah.
it's just a gap in coverage.
All right.
Well, actually, I want to say real quick is that in the near future, we're going to have Rick Walker. He is a CFO at Harlem Hospital, and he's actually going to come on the show. I'm going to get him to come on the show so he can talk more about affording health care at Harlem Hospital and in this community.
All right.
It's going to be an excellent show.
Yeah,
It will be
sure.
an excellent show,
Yeah.
just like all of our shows on Health in Harlem. And ladies and gentlemen, we're about to wrap up now, and I just want to thank Dr. Shanawaz Khan and Dr. Maheen Khan, the dynamic duo. Y'all, this was perfect because we had like a nice little match. Us, Sean and I, and then you
It's been
two.
fun.
It was
Yeah,
good.
too.
And we look forward to you returning. We know Dr. Khan will be back, and we hope Junior Dr. Khan will decide to
Absolutely.
join along.
And
She's
That'll
going to be
great.
senior next time she
Right?
comes.
She's-
She's going to be senior con.
Maurice, I would like to present a set of pen for the
Yes.
pharmacy week. The one is for
Yes.
Shan and one for you.
I was wondering because every
Oh,
year
shit, I got
Dr.
a
Khan has
gift.
gifts for us
Look at
every
it.
single year, and this is
You're
thank
the
you very
first
much.
guest that gave us a gift. I love this.
And I
it's
still have
blue.
my pharmacy week
That's
bags
right.
from each year. And ladies and gentlemen, we also want to thank Miss Valerie Wright,
Yes.
our producer.
Valerie. And she
Yes.
might be listening. I hope she is.
I hope so too. But if not, we still want to show her some love. And also, we want to thank Sean Shivers.
I want to thank Marie Selby.
You're welcome, my brother. It's my pleasure to be
My
here
pleasure also.
every time. And ladies and gentlemen, we'll be back next week at the same time, Thursday, 7 p.m. Tune in, and we'll have some more very, very good and useful information for you. Harlem, take care of yourself.
Thank you. Bye.
WHCR 90.3 FM, New York.
Rise up in spite, don't be shy, with love in your eyes. You got to be conscious, you got to be righteous. Can't you see the sign of the time we're living in? Got to use it, yeah. Every day, it's what we need today. Whoa. We got to use it, yeah. Every day, it's what we need today. Yeah. Wisdom and knowledge will guide you through